Welcome to another episode of the Your Longevity Blueprint podcast. Today, my guest is Dr. Bryce Appelbaum, who's a pioneer in neuro-optometry, passionate about unlocking life's potential through vision. His expertise includes reorganizing the visual brain post-concussion to return to learn and return to life, remediating visual developmental delays interfering with reading and learning, and enhancing visual skills to elevate sports performance. Dr. Appelbaum has been featured on the front page of USA Today, in the New York Times Magazine, Bethesda Magazine, and as the cover story of OT Advanced. Dr. Appelbaum has worked with hundreds of professional athletes, numerous professional and collegiate sports teams, and countless amateur athletes to transform raw talent into honed performance through vision. He also helps teams consider who to draft or sign as free agents based on assessing a player's visual potential and identifying how far off they may be from operating at that ceiling. He's the owner and managing doctor at Applebaum Vision PC, a private practice specializing in vision therapy and rehabilitation with offices in Bethesda and Annapolis, Maryland. Dr. Applebaum is a board-certified fellow of the College of Optometrists in Vision Development and an adjunct clinical professor at the Southern College of Optometry. Dr. Applebaum is on mission to change the way the world views vision. He believes there's more to vision than to just 20/20 eyesight and has developed programs to retrain the brain to revise the eyes. He's here with us today to discuss the misdiagnoses and missed opportunities of vision, why healthcare has it all wrong about the eyes. Welcome to the show, Dr. Applebaum.
Thank you so much for having me, Dr. Gray. Pleasure to be here.
That was quite the bio, kind of hard on my eyes. Just kidding.
I wanted to give you a workout to begin with. So.
So I do want to echo what I read in your bio. I want listeners to know why healthcare has it all wrong about the eyes. But first, what got you so interested in this unique specialty?
Great question. So when I was a child, I had very substantial visual developmental delays that contributed to a really high, abnormally high prescription at an early age. I had reduced eyesight. I had depth perception problems. I had sensory integration challenges, motor delays.
A lot.
Couldn't catch a ball. I was a mess. And luckily, my father was an eye doctor, and he was getting into this field and basically created this specialty for me where I attribute all of my success in life athletically, academically, a lot of even what I've learned interpersonally to what I learned with vision therapy. And obviously we'll talk about what's involved there, but I deeply know what it feels like to struggle with reading and learning, with feeling different, not being cast out by your peers, and even more so how unbelievably life-changing it can be to turn a weakness into a strength. And so now I'm very passionate about helping people and not letting them be on the path I was on.
Thanks, Dad. Yeah, good thing.
Right.
Good thing your dad was an eye doctor. So I love hearing, and a progressive one at that, because that was years ago, right?
Absolutely.
Sounds like. So let's dive into what vision therapy is. So I'm assuming that's what you use to help you, right? So what is vision therapy, and why have so many people not heard of this yet?
Great question. So vision therapy is essentially physical therapy for the brain through the eyes. So it's rewiring the software in the brain to change how somebody uses their visual system. So many people have not heard about this, and the mission I'm on is to raise awareness because we are all taught in school how to look at eyesight and eye health and how to intervene when there's disease and how to deal with structure, but so little on function. And you have to do a separate residency and fellowship and all of that, and there's just very few people in this space. You don't have to be board certified to offer vision therapy, but I would argue the level of care is dramatically different when you are. And so that's just a process that's elective, but it helps you really know what you know and what you don't know, and how to learn what you don't know.
Like, so how rare is this? Because we were talking before we started recording, there might be just one person near us that has even some of this minimal training, but like how rare? Are we talking like few eye doctors per state, or like how?
So definitely a handful per state, depending on the state as well. I'm in Maryland, right outside Washington, D.C. And in D.C. and Maryland, there are 8 doctors board certified out of like 6,000 or 7,000.
Wow.
And those 8 comprise 5 different practices. So there's a lot more people doing vision therapy. I know a lot of physical therapists have adopted some of these techniques, a lot of OTs, a lot of speech therapists, just based off of the awareness being raised.
Chiropractors too? I mean, are there
some?
Some
do. Some chiropractors will actually have somebody come in wearing their glasses and do manipulations and look at different balancing procedures through the lenses to see, like, is this prescription right? Is it off? And that's a little bit out there, but work on vision and the visual brain can be considered vision therapy, I guess, depending on the lens you're seeing
Mhm.
it through.
Hmm. I've already decided I needed it, but we'll get to that later in the episode. But let's talk about nearsightedness. So I think that's increasing at an alarming rate with children. And so part of me wants to think, is that from screens, and are screens bad for our eyes? Can we go there? Talk nearsightedness and, danger of screens?
So all visual skills are learned skills. And when every child is born, we don't know how to track or focus or converge or use our eyes. And it's something that through our life experiences, we develop the ability to use our eyes together. So that's something that's either learned well or not learned as well as it could be. And that's when some intervention is needed more so than ever. And I know you have a young child.
Hmm.
Kids are being introduced to technology at earlier and earlier ages than ever. Kids are reading in kindergarten when most are not visually ready for reading in kindergarten. And to really simplify it, if we're presented with stress from our environment and we don't have the tools in place to meet those demands, we either adapt or we avoid.
Mm.
Nearsightedness has two main components: genetics and environment. Can't do much about genetics, can't control who your
Hmm.
parents are. But environment wise, if you're presented with these challenges and you don't have the vision development to support that, then we usually adapt. And usually that occurs with near issues. So then far away blur becomes the symptom of the near problem. And our profession treats the symptom and says, well, you can't see the letters on the letter chart. Here are some glasses. And absolutely, that makes far away clear, but then very
Hmm.
often that becomes your new normal. You adapt to that. You need something stronger for the same clarity. And then you're on this cycle where you're in glasses for the rest of your life that are always changing.
Yikes. So are you saying screens are actually more bad at a younger age then?
A thousand
Like,
percent.
yeah, okay.
Screens are more bad at a younger age.
More bad.
Yeah, there are
Worse, yeah. Yeah.
guidelines from American Academy of Pediatrics that say no child under, I think it just says no child should be on the screen for more than 2 hours. I usually say, like, if you're under 18 months, limit screen time to just engaging
Never.
with
Or yeah.
ever, but FaceTime with a loved one, especially over COVID where you're not seeing somebody, but that's it.
Sure. Sure.
And then as you get older, that should go up to like 30 minutes if you're under 2, maybe an hour if you're under 5, and then really everything in moderation,
Sure.
taking as many breaks as you can.
So obviously an iPad in front of your face is, I would think, worse than, TV across the room. So is distance very important? I think you had a social media post about this, maybe with your kid, having them scooch back.
You know your
Yeah.
stuff.
Oh,
So
yeah.
yeah, so rule of thumb, larger the screen, the farther away, the better.
Okay.
So it gives all your listeners an excuse to go buy the biggest TV they can find and put it as far away as they can, because what happens when it's up close is it's a significantly different demand on the visual system. So the outside muscles have to converge the eyes, the inside muscles have to focus the eyes, and that synergy between those two systems is really the root cause of most functional visual developmental delays and the problems that occur.
Okay. Very interesting. I want to go back to genetics because you said one component of nearsightedness is genetics, because my eye doctor always says that, but I kind of feel like we always just blame everything on genetics. So that's true, but the variable we can change is the environment. Like you're saying, distance is on your side. Just
Absolutely. So genetics wise, based off of the alarming increase in nearsightedness that is dramatically increased, I think there's an estimation that by 2050, about half of the population will be nearsighted. So if
yeah.
both parents are nearsighted, the child has a 1 in 2 chance of becoming nearsighted.
Okay.
If one parent is, it's 1 in 3. And if zero parents are, I think it's 1 in 4. And that's just our environment. This wasn't an issue
Mhm.
50 years ago, before there were all these tablets and phones. And
Sure.
obviously there's a time and a place for tablets
Mhm.
for young kids, but I'm sure you've seen many parents who use a screen as a babysitter, and then
Mhm.
they're stuck at that distance forever.
And I
uh,
never thought I would be that parent, but there have been times where I'm like, just watch the,
well,
you know,
we
yeah,
all
yeah,
were there,
yeah,
right?
yep, yep.
But I think a good way to think about it is, like, if you were to squeeze your hand as hard as you can do it for maybe 5-10 seconds and your hand's going to start to kind of get sore and get tired. But if you were to do this open and close, you could do it for a very long time and still maintain that stamina. our muscles that control focus in our eyes are sphincter, they're circular. So when you look close, the muscle constricts. When you look far, it relaxes. You're stuck on a screen, you're stuck with it constricted. And there's not a whole lot you can do without looking away, taking breaks, and balancing that type of setup.
Yeah, sure. Makes sense. What about ADD, ADHD? So could those behaviors be due to hidden vision problems?
So we have a 30-question predictive checklist of the most common symptoms associated with treatable visual developmental delays. More than half of those symptoms are the exact same symptoms on the DSM-4 classification for ADD or ADHD. Most diagnoses of attention problems are based off of behavior and observation and sometimes testing, but there's not really a way to measure a biochemical balance in the brain to know whether somebody needs more of a certain neurotransmitter or doesn't. From a vision standpoint, there's two particular diagnoses, but the most common one is something called convergence insufficiency.
Explain that. Yeah.
Absolutely. So convergence insufficiency means, by the language, you think it means that somebody can't cross their eyes. But essentially what it is a spatial mismatch in that the outside muscles are not coordinating well to keep both eyes pointing and focused on a near target. So a simple way to test this is take an expensive piece of equipment, take a pen or pencil, have your child or yourself look at that, and you're going to bring it close along your midline all the way up to your nose until you can't make it single or clear anymore. It should be pretty effortless to our nose, but for so many kids that near point of convergence is reduced, and so they say they can't make it one. There becomes this competition between which eye looks at it, and then they look away, or you see an eye drift. Convergence insufficiency is so unbelievably common in kids. As some studies say, as high as 20% of kids have this. But if you're diagnosed with that, you're way more likely to be mislabeled as having a problem with attention, because think about a child in a classroom setting or being asked to read or write. You're having to converge your eyes to be up close. This only happens at near. And if you can't maintain the stamina or keep your eyes pointing and focus at that place, the words move, you lose your place. You have to look away and disengage. And so often kids in the classroom are not paying attention, or it seems like that, but they're really relying on auditory rather than vision, because vision's not providing them the feedback that they want or deserve.
So before you medicate your children, listen to the episode where we talk about diet, reducing inflammatory foods, and also get vision checked. But I don't even say get your vision checked, because parents are getting their children's vision checked.
So here's a great way to look at it. Think of eyesight and vision as separate entities. Eyesight's how well we see. That's letters on a letter chart in an eye exam, a street sign when you're driving, the board in the classroom. Vision is entirely brain, and how the brain tells the eyes what to do and how we derive meaning, direct action.
I like that.
So even just asking any eye doctor should know how to test for convergence insufficiency.
Okay, so you can ask for that then.
You can ask for that. They may not. I think what it means, what it implies, and the treatment is going to be all over the place. But there's lots of great resources online that give tons of information on convergence insufficiency and treatable vision problems. One great one is visionhelp.com, VISIONHELP. It's a complete advocacy group I'm a part of with the goal of just raising awareness.
Sure.
And there's videos, research, a lot on there on convergence insufficiency, and a ton of other stuff as well.
For the listeners, I'll post that link in the show notes too. Great information. Okay, what about dyslexia?
So along similar lines, dyslexia by definition means difficulty reading words. I'm biased, of course, but I would say 95% of people I work with have difficulty reading words, but because of a vision problem that was hidden previously. So often tracking our eyes and keeping them pointing on the word across the page, and focusing our eyes and making the words clear, and converging our eyes to see a single clear image. If those are not operating or functioning where they should, it's going to be a lot harder to read those words, to decode, to then comprehend that information, to think about that information. And so very often, kind of like ADD or ADHD, dyslexia is a diagnosis that describes behavior. There's more testing that's standardized to kind of assign that label, but it's very often the visual centers and language centers are not communicating with each other. And there's lots of different treatments out there that can help improve reading. especially for those with that label of dyslexia, because oftentimes it's not accurate. And when it is accurate and there's problems with phonological awareness and kind of getting the sounds with the letters and the words and being able to filter all that and make sense of it, that's something that can be improved with the right type of learning to take place.
Good to hear. Okay. What would you say some of your not your misperceptions, what are some of probably the listeners' misperceptions about vision?
I could go in so many directions here. So I would say one of the biggest is your prescription shouldn't really change every year. And that's kind of
Yeah.
an explosion in many people's minds. If we're adapting to the lens we're in and we're needing something stronger to maintain the same clarity, we're kind of going down a path. But if we think about a functional root cause of that is maybe the focusing system can't hold focus and can't
Mhm.
sustain it, or there's not flexibility there, or we're on screens too much, or we're not able to meet the demands of life. You treat the symptom, it gets far away, has to get clear with a stronger lens. But if you
Mhm.
treat the problem, the underlying functional coordination problem, then the symptom goes away.
Which makes
So
me so angry because I feel like that was me year after year after year. Granted, I was obviously on my computer or in books studying, right? So through my early 20s and even into my 30s, and
yeah.
my doctor kept saying, "Oh, your vision will normalize. It'll quit declining." Because I was thinking at that time I wanted to get LASIK eye surgery, and every year I'd go back and I kept thinking, well, certainly this is this deterioration is gonna level off, and I can eventually qualify for LASIK. And my vision just kept getting worse, and it kept wanting to up my prescription. And I finally said,
Mhm.
no, I don't want it upped anymore. I feel like, because I had someone in one of my classes who was from another country, and she said, no, no, when we go to see our eye doctor, like we ask for less power, not more power, because we want to, work our eyes and not just be kind of dependent on that. But I feel like I got robbed. I feel like I kind of got
Yeah, well,
screwed
and to
because,
be so much of the world is robbed.
yeah,
We're all taught to have everybody see the smallest letters crystal clear HD all day long. Not everybody has to see the same. You have to have vision not interfere and be able to see clear enough to be successful in life. But
right.
I mean, you're absolutely right. And I think there's a joke in our profession that it's rare to find an attorney or a doctor or somebody who's been through a lot of reading and studying and schooling who doesn't have a
Yeah.
prescription.
Mm-hmm.
I mean, we adapt to near. If we adapt to everything in life, we either avoid or adapt. So if we're adapting, the more near there is, the more near visual demands, the more likely that far away is going to be compromised.
Mm, yikes.
Evolutionarily, we're meant to be scanning the horizon and looking
Yes.
for things in the distance. We're now making these scanning eye movements on screens with really small font and graphics all day long in many cases. And these problems were much rarer many, many years ago.
Okay, so that's one misperception. Got a few more.
Yes, I would say that one of the big ones that I get asked about all the time is the right drops for our eyes.
Yes.
And I
Yes.
wanna, if your listeners can leave with one take home, well, two take homes. One's going to be that vision therapy can change your life. Number two, don't use Visine. And
Mm-hmm.
Visine is a eye drop that constricts the blood vessels so that the eyes don't appear as red. But the second the drug wears off, there's a rebound effect that's twice as high,
Mm-hmm.
and they're red for a reason. The red blood vessels are red to bring in more oxygen because of some underlying cause. And if you figure out, I mean, there's plenty of drops that are great, like artificial tears that are non-preservative, or there's supplements you can take that can help with that. But I think in most cases, the redness is because of some sort of dryness or irritation or virus or bacteria. Visine makes it worse, so please don't use that.
You have a good video on that on your Instagram as well, which that caught my eye, haha. But I
Nice.
but I previously had Claudia, Claudia on the show. Her episode hasn't aired yet, but it'll likely air before yours will actually. And we talked a little bit about just dry eyes in general. And she
Yeah.
does recommend resting your eyes, right? And cupping your eyes and like blinking to help with dry whatnot. But one of my questions I had for her, which is the same question for you, of course, is what are the best eye drops? You're saying non-preservative. So
Definitely
the single
non-preservative.
use, like the single use, I do use those because I have pretty bad dry eye, unfortunately. But I think those are housed in plastic. And because I have a hormone clinic, right, and I'm so worried about endocrine disrupting chemicals, I can't help but wonder, if those eye drops get shipped from Amazon, they're in my mailbox sitting in 100 degrees in Iowa weather. Is that plastic leaching into the, I don't
And
know.
and to be honest, we don't really
No.
know. There's not
Yeah.
enough has been done there, but I can give you a solution that avoids all of that. One hack for your health: omega-3 fatty acids
Which I
are
take, thank you. Yes. Yes.
they're amazing. But from the tear film standpoint, there's three layers to our tear film. The outer layer is a layer called the mucin layer. Omega-3 is in the right consistency and the right quality.
Mhm.
So at least I usually recommend 1,000 milligrams twice a day. Produces that layer of the tear film in a more viscous, thicker fashion, so your tears don't evaporate as quickly. There's
Great.
a protective barrier, and it's rare for somebody with mild dryness who takes omega-3 fatty acids to not see a huge improvement in terms of symptoms. And then you're avoiding plastic and bottles if it's good sourced fish
Omega-3.
oil and in
Yes.
the right place.
Absolutely. And I do notice my husband, I complain about my dry eyes. And then he says, well, how much fish oil are you taking? Because I do notice when I take 2 grams versus 1 gram, I do notice a
Careful.
difference. Because I've taken 1 gram like almost my entire life, even as a kid. Like, but when I jump it up, I do notice a difference, I feel like, with the 2 grams. But
And
let
this,
me, oh, go
can I
ahead.
just add one quick thing? So I
Yeah.
would say ideally for the first 2 weeks, take 1 gram at separate intervals. So one in the morning, one at night, and then
Divided.
divide it. You'll be able to
Agreed.
absorb it more easily.
Yep. Yep. I thank you. I would agree with that. So Claudia had recommended I think they're from Switzerland, Similasan or something like that. Have you heard of
Mhm.
those? More
I
homeopathic?
have.
What do you think? What are your thoughts? I did order them. I haven't used them yet, but
I would say they can be very helpful. They're a little more natural and holistic, and I
yeah,
think
yeah,
there's some really good drops like Cystane or Soothe or
that's what yep,
Refresh
yep,
that are, I would say, equally as good and in many cases more effective.
sure.
But as long as there's no preservatives and as long as you're trusting what's in there, then that's great. I think drinking a ton of water can be helpful.
Mhm.
But I think in general that's a fine one, but it's I'll leave it at that.
Any other misperceptions?
Yes, misperceptions about eye problems being brain problems. All eye problems are brain problems for the most part. So
Okay.
any problem with tracking or focusing or converging or eye teaming or depth perception are all problems that initiate in the brain and can be treated through the brain. And if you're addressing it on an eye basis, it makes it much harder to be able to see any changes in terms of the problems that are occurring. There's neuroplasticity at every age.
Let's
Uh,
talk about that. Define neuroplasticity. Let's go there. Yeah.
Yeah, so neuroplasticity is our brain's ability to learn new things and to create new synaptic connections or new wiring that supports what is being learned. Any brain at any age can be taught new tricks. One of the biggest misperceptions in the vision world from doctors is that most are taught in school, and I was taught in school, and I graduated optometry school in 2009, that there's a critical period for vision development, and that after age 8, you blow out the candles, and then all of a sudden, the visual centers of the brain can no longer be taught, and what you see is what you get, and you're stuck with where everything is. As silly as that sounds, that's still preached by the majority of ophthalmology and a lot of doctors, again, who are trained on intervention of eye disease and on structure, not on function. I currently have a 98-year-old, 92-year-old, an 89-year-old all in vision therapy, developing depth perception for the first time. I will
Wow.
say as we get older, malleability decreases, and there's, as you can attest to, when infants, kids, our brains are like sponges, and you can learn things so much more easily. But with the right arrangement of conditions and the right situation where you're appropriately being taught from the right sequence of learning and from the right foundation, any brain at any age can be retaught. Depth perception can be developed at any age as long as there's two eyes, and we can tap into that wiring.
Very encouraging. Okay. Any other misperceptions, or did we cover the
How
most
long
important?
do we have here?
I know.
I've got a bunch. I think there's a lot about patching and about
Let's go there. Yeah.
okay. So so let's first kind of clarify two different terms that often get confused: strabismus and amblyopia.
Okay.
Strabismus is an eye turn, amblyopia is a lazy eye. Both of these have huge misperceptions. So start with strabismus, which is an eye turn. Most eye turns are brain problems manifesting through the eyes, meaning there's no concern with eye muscle strength or length. It's the same with all of the 6 eye muscles that surround each eye externally. It's more coordination. So if we can go back to what we talked about earlier about vision is learned, a child who skips over crawling or who walks too early and doesn't have the bilateral integration and the motor foundation to support the vision learning that comes, and all of a sudden everything's static, and then they start moving and are unstable, and then their eye teaming, their visual system is all unstable. Very often an eye turn stems from walking before we're ready to be walking. Fast forward then to later in life, eye turns are developed. If we're talking about the convergence insufficiency, which is fragile eye teaming at near, if we're then, because of a rivalry or competition over sensory input, meaning the brain can't understand how to filter both eyes at the same time, it picks one, it ignores the other, and throws it in or out or up or down so that it doesn't have to be involved with vision learning. Most eye turns are treated from a medical community standpoint with eye muscle surgery.
Oh, okay. I was thinking that's where I was thinking the patch was coming in, but yeah, okay, yeah, yeah.
Also, with eye muscle surgery, it's very, very rare to have a functional cure. Best case scenario is a cosmetic cure, meaning the eyes look like they're straight. But for them to act like they're straight and for them to act like they're working together, the visual centers of the brain we were talking about need to then learn how to use both eyes together and filter and process the input at the same time to develop 3D vision or depth perception. Amblyopia, which is the lazy eye, meaning one eye not seeing as well as the other, stems from one of three different things. Either the prescription's really high or different in one eye, and the brain, rather than using both, says, I want to use the eye that's easier to see clearly with, I'm going to just ignore the other. It happens from an eye turn, meaning if one eye is out and the other eye is straight, vision development doesn't happen with that outside eye, and so the brain just learns how to see with the eye that's straight and the other eye gets ignored. Or it happens if there's some sort of structural problem early on, like somebody's born with a cataract in their eye, or has, for whatever reason, some sort of blockage from that brain using that eye. Then amblyopia, which is the ability to see the small letters, the inability to see the small letters, that's what comes out. Old school treatment is patching. So to look at it as a good eye and a bad eye. So let's cover up the good eye so the bad eye has to work. We now have the research to support what my profession has known forever, in that amblyopia is a two-eyed problem just showing up on one side. And unless it's addressed on a two-eyed basis, it doesn't really get better. So a lot of kids who go through patching, not even considering the emotional toll that takes, walking around with a patch on and feeling different from their peers and not being able to see out of that eye. But from a functional standpoint, it's teaching the bad eye to engage in the presence of the good eye. And so the advanced treatments are literally learning how to pick out that eye's input when the other eye is there. So that's done with virtual reality or augmented reality or different filters or lenses or prism, all the tools that we have with optometric vision therapy to be able to equalize the skills with each eye. So when both eyes are open, neither one takes over because there's not a difference between each eye's information. Does that make sense?
Yes, super interesting. But now I want to go off on another tangent about eye patching, because my brother had a retinal detachment in his mid-30s. And I feel bad because he told me I'm losing my vision, and I said go to the eye doctor, but I should have said go now, not wait.
Oh, good.
So I kind of feel bad. Like I could have pressured him to go earlier. He's very lucky he didn't lose vision in that eye. I mean, they said he was one in I don't know, 100,000. I mean, it was a very rare case because he had no other risk factors. There was no trauma, nothing. But basically he had surgery and then he wore a patch for almost a year. And I think he was disserviced. And because I'm hearing about things like vision therapy right now, and I'm just wondering what he maybe wasn't offered that he should have been. But he finally got the patch off, and the eye is, I mean, his vision is it's terrible in that eye.
Yeah.
And
I will
yeah,
correct something I did say. If the
okay,
discrepancy is very, very large between each eye, meaning like one eye
like,
can see the small letters, the other one can't even tell where the lights are
yep,
on,
yep,
or just the big E, then patching can be effective, but really active learning with the patch on is what's needed.
sure,
It's not just go through life covering that eye. It's
right.
more, let's do like discriminatory tasks. So,
Mhm.
picking up straws, cutting up in little pieces and taking a stick and scooping them up, or for a child, stringing Fruit Loops or Cheerios on a string. This kind of visually guided motor
Mm.
control work then allows the brain to put together the input from the tactile senses and the auditory senses with the visual senses to be able to then understand more effectively where that is and how
Mhm.
to engage with it.
Hmm. Yeah, I think he needs to see you, but okay, so let's
Happy
so
to.
yeah. So let's transition to sports for a minute. So in your
Yes.
bio, obviously you work with a lot of athletes, which is super just fascinating. So I do want to get to concussion and injuries, sports injuries, but first let's talk about how vision impacts sports performance.
Absolutely. So if you can think about at an early age, and you're probably doing this with your son, you're saying, all right, you got to keep your eye on the ball. And you're always taught that, but we're never really taught how to do that, right? So from a sports performance standpoint, the things that matter in sports are obviously seeing the ball and knowing where the ball is, but most importantly, being able to anticipate where the ball will be. So having really good depth perception that's dynamic, understanding your sense of self in space accurately, being able to use peripheral vision with central vision at the same time. A lot of athletes always talk about being in the zone. When you're in the zone, that's this kind of locked in, heightened state of visual arousal where it's almost like you are in this tunnel vision and nothing else around you is going on because you're so locked in. We can actually teach that and teach
Hmm.
somebody to be able to slip into that place where they are so heightened peripherally that they can lock in and localize centrally really, really well. So I work with a lot of teams and players at the professional level and at the high level where it's small incremental changes in lots of different areas leads to a large cumulative effect in terms of
Sure.
performance. But especially, a child or somebody who's a weekend warrior trying to compete with other dads or moms or other peers. From a vision standpoint, the small ball sports vision matters that much more. So baseball, softball, basketball, tennis. I think vision development and cognitive development and how well they coincide matters a ton. And for somebody to have athletic talent that's just God given and natural, you can't really train that. But to be able to allow somebody to maximize what they do
Yes.
have and utilize it for longer, I mean, you can teach somebody how to see the court or the field from other perspectives, or how to learn a playbook more efficiently, or have visual memory that supports rapid changes that they can then filter and process like a movie rather than a flip book, let's say. So being first identifying the areas of opportunity for learning is
Mm-hmm.
important, but then
Mm-hmm.
knowing how to close those gaps and to clean things up so that uh, take the talent you already have, but elevating it by achieving at the potential based off of using vision as that dominant sensory system that's guiding and leading rather than one that's just kind of there.
So you have a screening or assessment that you put your athletes through, and then obviously you find their weaknesses and
Yeah, so
yeah,
I
I mean, in a
do
simplistic, yeah, easy
my
for me to
my
say.
most thorough evaluation is about 3 hours long,
Wow.
and it's looking at lots of different areas. We have a much shorter one that we'll do for more as like a screening tool, but we work with lots of teams, lots of players in unique sports, a lot of people with race car driving and with
Mhm.
archery and riflery and fencing. I mean, sport vision. I'm biased, of course. Vision matters, and it matters in
Mhm.
all
Mhm.
sports. But certain sports, it matters a lot more than others. So there are specialists who do sports vision evaluations. There's a few doctors who that's all they do,
Mm.
but especially people in the vision therapy world. at least have an understanding of how to elevate performance. And many, that's a little bit more of a niche than anything else, but even less so than those who do vision therapy. There's not so many sports vision eye doctors out there.
Serious question. Can I elevate the sports performance in a 3.5-year-old by improving his vision? How does he
Uh,
get it?
so knowing that vision's on a continuum,
Yeah,
and
yeah.
there's certain skills that are considered normal for a 3.5-year-old. I mean, we have put a lot of young kids who are on home programs where we are literally advancing vision development so that, because there's a problem, but also just to help it become, you
Yeah.
know, that much more efficient. So depends on what sport you're trying to teach.
Mhm. Well, baseball, absolutely baseball, but no,
I mean,
if you talk
honestly,
to my husband, yeah.
playing
But
catch, being at
yeah,
different distances, different size
yeah,
balls. I mean, that you drill that hard early on. Not that I'm suggesting we do that, because
yeah,
then you can burn them out. But I mean, that's something that there's a reason why repetition and practice really does matter.
absolutely. Absolutely. You got me thinking, when you see the little, even like the 2.5-year-olds who try to hit the ball off the tee and they're obviously not always hitting the ball or hitting the tee. I mean, yes, that
Mhm.
could be a coordination thing, but is it just their vision is still
Well,
developing? And like,
if
is
you
that
think about
part of
how hard it is, like with your body rotating, to be able to hold fixation on something as all your gross motor muscles are moving, or as you're trying to
yeah.
rotate or turn. I mean, when you see a 2.5, 3-year-old who's like hitting a golf ball or hitting off the tee, and there's a reason these go viral. It's not
It's
normal,
incredible. Yeah,
right?
yeah, 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 totally. Fun, fun. Okay, let's talk more. I don't want to say doom and gloom because there's something we can do about this, but let's talk about sports related injuries. So, what is a
Yes.
concussion and how is vision impacted with concussions?
Great question. So this is becoming a huge topic in my specialty, and actually my private practice now is over 50% concussion and brain injury rehab,
Wow.
and it's only increasing every year. So a concussion is any type of kind of insult or trauma to the brain. A lot of people think it has to be from this massive blow or hit, but we now know that even the most sudden little acceleration or deceleration of the brainstem, like a whiplash, can be
Mhm.
considered a concussion, because the damage that occurs neuronally to the brain is at such a small microcellular level that it impacts function, and structure in many cases as well. Vision is represented in every lobe of the brain. There's more areas of the brain dedicated to processing vision than every other sense combined. So it's almost impossible to have a head injury, in my opinion, not have vision be impacted. It's just a matter of at what level is it. And the most common symptoms with head injury very often are related to vision. Fatigue, eye
Mhm.
strain,
Yeah.
headache, brain fog, dizziness. And I think, first of all, anybody who, is suspected to have a head injury or experiences any of these symptoms after any type of head injury, car accident, anything like that, I mean, they should consult a sports medicine physician and be evaluated to determine what's going on. I will say, in doing that, make sure, especially as a parent, you recognize that most of the testing after a suspected head injury is going to come back normal, meaning
Mhm.
MRIs, CAT scans, CT scans. We run those to make sure there's nothing terrible and catastrophic happening. And
Right.
sometimes there is. And then without doing those tests, you're not going to see them. But, usually those all show everything is fine. And then it's kind of like, all right, your brain is bruised, go rest and go take it easy. That was the old school philosophy, is rest and sit in a dark room and don't be around anything, sensory wise. And now I think we were at the other end of the spectrum. Now we're a little bit more in the middle. I think a lot of head injuries do resolve on their own in terms of the symptoms, and then do improve with time. And a larger percentage of older adolescents do return to like a pre-injury level, let's say, before head injury, and a lot of adults do, but for many it can take a lot longer. And I think there's an interesting study that came out fairly recently that said, I think it was after a year after a concussion, or a year after a concussion, a third of kids still have symptoms or headache or irritability that
Mm,
can affect school performance. And very often the child feels, if it's a child who can't articulate or communicate how they're feeling or what's going on, it's just behavior is different, frustrations are different. And the symptoms that happen from a concussion very often don't go away without active work or active learning to take place, and that can really complicate the recovery, getting back to previous level of functioning, and can make it so life is very different, and going to a mall or grocery store with all the sensory input is this overload, or seeing a pattern on a shirt is dizzying or nauseating, or you're getting
Mm-hmm.
motion sick and things like that. And I think that's something that um, is getting a lot more awareness now as we are all learning about head injuries and getting research coming out and having athletes who are now speaking up. But our brains are the only brains we got. And I know this is your bread and butter and what you are the expert in, but we got to take care of our brains and be able to
Mm-hmm.
get to a place where we can prevent the avoidable head injuries that happen down the road, because we know with one head injury, we're more likely to have another and another, unless we're able to rehabilitate, especially the visual brain, and get back to a place where we know where we're located in space and where the things are in relation to us.
Would you say a lot of, you call them like the sports medicine physicians who
Mhm.
kind of treat the concussion, do they seek out someone like you for vision therapy? I mean, is that,
The ones who know what they're doing,
yeah, they
I
should,
think
is what you're saying. They should. Yeah.
they
Yeah.
should. I think a lot of PT has adopted vision work and
Hmm.
vestibular work to help with concussion recovery, just because the need is so great. And PT adopted this, which I think is fantastic, but a lot of times it does leave people kind of up a creek without a paddle, where they're doing
Hmm.
some vision work where it's like eye jumps from one place to another, or vestibular work, which is kind of that internal orientation system that lets us know which way is up and down and left and right. And with most head injuries, there's some level of disconnect between vision and vestibular input, where we're not able to integrate central and peripheral processing at the same time. And so PT does some work there. I think all the big, at least by us, all the hospitals that are really progressive and developing programs for head injury, they have a vestibular PT on staff. They have
Awesome. Yeah.
in-house stuff, but then at least for the ones in the area by me, I usually only get sent the ones who are just not getting better at the speed or rate that they
Hmm.
should. And um, it's crazy to think that almost any head injury, and when I say almost, the vast majority, you can get back to previous level of functioning with the right work and the right motivation.
Can you, I'm not really trained in acute care medicine, but quickly for our listeners, what should someone do if they get a concussion? I mean, obviously you go to the ER, but like if it's minor or are
Yeah.
there any just basic tips? Like should they take anti-inflammatories? Like what are some?
So I think definitely, don't go to sleep right away. That's the type of thing that I think a lot of doctors are pretty consistent with is,
Hmm.
when that happens, try and obviously remove yourself from play. That's a big issue if it's from sports, but most head injuries are not from sports now. Um, I think for the first couple weeks, omega-3s are hugely important. There's a
Yep.
neurologist I work with who prescribes for anyone who's had a head injury, whether it was a recent one or years ago, a loading dose of 9 grams for the first two
Wow.
weeks and then
Yeah.
6 grams thereafter. I think that's a lot, but
Hmm.
that omega-3s help facilitate healing, and our
Yep.
brain is made out of, those
Yep. Yep.
substances. So, but I think, changing nutrition and increasing protein and increasing hydration and electrolytes, and there's lots of supplements that are important as well. Um, but I think definitely getting it checked out. Anti-inflammatories can help
Hmm.
obviously remediate the symptoms and the headaches that are occurring, but kind of trying to avoid environments with lots of bright lights and,
Stimulation. Yeah.
yep, and noise, and that heightened sense of
Mhm.
arousal is what really just allows that autonomic nervous system to turn into a fight or flight response, and then you just want to
Sure.
retreat and do nothing.
Sure. Sure. Um, Couple other questions. This is great. I'm thinking, where should I go next? You did mention COVID a few times, like when we kind of opened the episode talking about how, yeah, parents probably were letting their kids FaceTime, see grandparents or, whatnot.
Yeah, yeah.
So how else has COVID impacted our eyes? What'd you say?
So two main areas. The first, we stopped counting. It's been so high. Patients who've come in with symptoms and findings in a presentation completely consistent with a concussion or head injury, but who haven't had a head injury. And in doing a lot of research or a lot of digging in terms of the history, in many of these cases, it was either after getting COVID, after receiving a vaccine or a booster, and I don't think we should go down that route of talking about all that. But if there's low level inflammation, and then there's some sort of event that allows for that inflammatory cascade to then increase, it can create these symptoms that are like a head injury. So the dizziness, the blurriness, the headaches, the fatigue, all of that. But I think more consistently across the board, and when I say across the board, like almost everybody I'm seeing, if we go back to what we talked about visual stress and stress from our environment, if we don't have the tools in place to meet the demands of the stress, we adapt or we avoid. We are not meant to be staring at screens all day. And especially with virtual learning for kids who don't have the visual development systems in place,
Yep.
or telework for adults, we're staring at a screen for sometimes 10, 12, even longer hours of the day without even getting up or looking away. And I think there's so much we can do to set up visual ergonomics, to take breaks, to be able to force our brain to disengage and to get outside and to balance the distance with the near demands. But I would say from COVID, the incidence of nearsightedness has dramatically increased. The amount of kids with visual developmental delays impacting learning and reading has definitely increased. And the amount of headaches and eye strain from what I'm seeing has increased. One great solution for this is there are certain glasses that can be helpful for a lot of people. Everyone's kind of heard about blue blocking filters, and that's helpful. But I think blue blocking filters with the right performance lenses in them. So in many cases, it's a low plus magnification that relaxes the focus, or sometimes prism that helps disengage so you don't have to converge the eyes as much. There's support systems in the setup of a lens or spectacle lens that can really help make it so that there's less visual stress, and then your internal response to that is different. From the blue light standpoint, blue light is not bad. Blue light is actually good for us in certain quantities and in certain scenarios. But blue light blocking glasses blocks a certain wavelength of light. And that's that high contrast, high energy, bright light from the screens that's artificial. Artificial light's different than natural light. But with that artificial light, a higher quality blue light blocking lens is going to block a larger wavelength, so a larger range. So it's more protective versus the $5 ones that you see on Amazon. For most people, doesn't really have too much of a protective benefit.
Yep. And I found out those have like 10%, blue light blocking ability. It's not like they're blocking 100%. If you really want to block blue light, you got to wear the nerdy, amber like
Absolutely.
glasses. Those are the ones that block the blue light. So if they're really fashionable, but $10 off Amazon, they're probably only slightly blocking the blue light.
But also for your
to my
listeners,
understanding, yeah.
I mean, ask them when they go to their eye doctor. That's almost always an add-on that you can get on glasses. But ask about different tiers. I know my practice, we have 3 different tiers of blue light blocking filters, and almost never do we even allow somebody to get the lowest tier, which says just go get it online, it's cheaper and going to make more sense. But the higher tier, you're blocking a larger range. And just like you said, the ones that actually have tints in them because they're blocking that much light aren't always needed, but are life-changing. I have many patients who they wear those all day long because that's the only way you can get out of bed.
Yeah. Yep. I want to go to motion sickness next, because this is something I've struggled with. So how's vision related to car sickness?
So in my opinion, this is one of the biggest kept secrets in eye care, or at least in
Lay it on us. Yeah.
in the vision therapy world. So for most people who are motion sick, it's usually way worse when you're in the back seat, if you're reading, if you're on a tablet, if you're on a train and you're trying to read and everything's going sideways. Motion sickness from a lot of perspectives is thought about inner ear and certain things like Meniere's disease and things like that, which that's not my wheelhouse. That's not amendable to this type of treatment and what I specialize in. But I would say that probably about 80 to 85% of motion sickness has a visual component that's treatable. So I don't want to get into the weeds with neurology, but to really simplify it, we have 2 different types of visual processing pathways in our brain that are wired together. One that responds to central focal visual input, and one that responds to peripheral ambient visual input. And when those are providing the same feedback on where something is in space, what's in motion, what's not, they we're then functioning in a healthy way, and we're not experiencing motion sickness. What happens when we're in a car and in those scenarios we're in the back seat or reading or on a tablet, we're overriding the focal input that's telling our brain that we are static and we are not in motion. Yet the vestibular system and the peripheral processing system activates this receptors that allow us to know we're in motion. And our brain is in this disconnect where it's kind of almost like a seesaw going back and forth between using those two systems to process information. And that push and pull, or that tug of war, makes it so that we don't know which way is up or down or left or right and where we are, which is why when we're sitting in the front seat or when we're
Yeah.
driving, we can override central focal processing and
Sure.
plan ahead and plan our body ahead for the turns that are coming, even unconsciously. So I would say it's rare to not have motion sickness improve with neurooptometric vision therapy, but in many cases completely eliminated.
Sounds like
If
a
in fact,
dream. Yeah, it sounds
if in
amazing.
fact
Yeah.
it's not motion sickness, other things like that.
Sure.
Can I give your listeners a procedure to do at home to help with motion sickness?
Please, please. Yeah.
For this will help some, it may help a ton. It's called the infinity walk. So if you can picture an infinity sign, it's kind of like the number 8 turned. Start off by putting like 2 stools in a room or 2 objects, and you're basically going to be walking in an infinity's path around the stools.
With your eyes or physically? You
physically walking.
Okay.
But trying to you put like a sticker on the wall or look at something on the wall so that as you're turning, you're never looking away from the sticker or never looking away from the wall. So you're walking in this infinity pattern, but you're making all these body and neck and head rotations while never losing fixation. And that creates a wonderful cross-cerebral, cross-brain connection that doing that enough with the right kind of building can help a lot of people. And if you even Google infinity walk, you'll see a lot of different procedures out there that build off of that. You can then add eye movements to it. You can add changes in position. You can move away the different the stools that you're walking around, and you can visualize where they are. You can make the pattern larger. You can make it smaller in terms of the path you're on. You can change directions. You can turn on a metronome, and every X amount of beats, you're changing direction there, because then you're integrating multiple sensory input. I mean, there's a lot that can be done to start broad and then fine tune that moving forward.
So is that like what vision therapy is? Like these sort of exercises that kind of teach? I mean, is that part of the?
So I would say yes, but vision therapy is more like that on steroids. Vision therapy relies a lot on lenses and prism and filters and take for instance
a lot more than
But take for instance that infinity walk there. But instead of, as we're building that, maybe we have then a target on the wall where it's a picture of a clown in a hat, and the clown is seen by the right eye and the hat seen by the left eye, and you're wearing red-green glasses or Polaroid filters that controls what each eye sees and how each eye filters, so that when the eyes disengage or become unstable, you'll see the hat shift. And then maybe we'll use a lens or prism to artificially change where the hat's located, move it on top of the clown, and then teach the patient what it feels like, what it looks like, and the depth or the 3D awareness that occurs when the eyes are working together. And then we ask them to reproduce that setup, whether it's with movement or on an overhead or projected out a window, and then using lenses or prism to support what they can't do on their own, but then eventually substituting their visual skills or abilities for what that was doing, so that the hat's on top of the clown without the help of any other filter, lenses, or prism, because your eyes are pointing in the same place and your brain's turning on and responding to that information appropriately. Does that make sense a little?
Yes. I mean, it's somewhat over my head, and I'm sure the listeners, but it sounds amazing. Yeah. It takes a smart person to figure that out.
Vision therapy is arranging the conditions to raise to somebody's awareness what they're doing, so they can learn how to self-correct and self-monitor and make bad habits no longer options.
Love it. We could end the episode right there, but I have to ask one more question and we'll wrap up.
Absolutely.
So I do want to ask about supplements to promote the longevity of the eyes, because you mentioned fish oil. Briefly, do you want to just mention a couple others if you have some top favorites?
Yes. Well, first with fish, I think cold water fish, which you probably can speak to way better than anybody else. Green leafy vegetables. are fantastic. Kale, collard greens, spinach, all of that, and the lutein and zeaxanthin that's in there is great for the macula, which is the sweet spot of your eye for the line of sight. Eggs are great. They have lutein. They have I
Lots of
think any
choline, but yeah.
lots of choline.
Yeah.
Absolutely. I think vitamins A, C, and E, and citrus fruits and fruits with and dark fruits with antioxidants,
Mm-hmm.
great for preventing macular degeneration, cataracts. And I know you're big on nutrition as well. There's a lot of information coming out now about how macular degeneration can almost be viewed as like type 3 diabetes, and is in response to inflammation and insulin resistance. We have a lot of patients who we put on a strict elimination diet or on a keto diet where they can shift how their brain and body is functioning as what it's using as a fuel source, going away from sugar, going into ketones, and especially if there's inflammation already or concussion, that speeds up the recovery dramatically. Coenzyme Q is great. Carrots, broccoli.
This is how we should be eating for our hormones as well, listeners. Yeah, not just for our eyes, right? Just in general, this is how we should be eating. So.
Well, and you probably see with a lot of your clients and patients that when hormones are all out of whack, some of the symptoms are visual.
Absolutely.
The brain fog comes from a lot of different areas, but hormonally, that should be the first thing we're addressing.
And back to concussion, I know progesterone's neuroprotective, testosterone's great for blood flow. Optimizing hormones can even help with recovery from injury and concussion and whatnot too. So a little plug in for hormones there. Well, this has been amazing. So tell us where listeners can find you. So do you work with clients virtually if someone's listening and they want to work with you? Do you work virtually or do you have any sort of online programs? Kind of tell us about your business.
Great question. So my practice is in Maryland, outside DC, but as of this year, I've set up a way to work with people virtually. It's drbryceappelbaum.com. There's a lot of different things that ways to work with me or ways to offer help. We have a couple different programs. We have one called ScreenFit, which is absolutely awesome and fantastic, and it's a wellness program designed to help people engage with screens for longer by doing vision exercises daily, almost like going to the gym for your eyes, so that screens are less terrible and that you can develop the systems to support those demands, even though we should be avoiding screens as much as we can. So screenfit.com is where you can find that, and would love to offer a discount to all of your listeners here. We'll put the discount code, if you can put it in the show notes maybe, but we can give a discount to join that. And then I'm on Instagram, Dr. Bryce Appelbaum, and practice website, applebaumvision.com. But I hope that everyone learned a ton and learned that we all know better so we can do better. And we should be challenging doctors and people where things don't make sense. And unfortunately, it's a problem with the eye care world more than anything else, but vision matters way more than eyesight. Think of those as different things.
Love it. Okay. I would ask your top longevity tip, but I feel like that last sentence was great. Longevity tip. What's your top longevity tip? Yeah.
So everyone's heard of 20/20 eyesight. Everyone should be doing a 20/20/20 rule, which means with screen time, with near work, with anything up close, never more than 20 minutes without taking a break for 20 seconds and looking at something 20 feet away. Speaking of longevity, most people around their 40th birthday, all of a sudden arms aren't long enough. You have to hold things farther away. We can train our bodies, we can train our muscles, but for some reason people think we can't train our eye muscles and we can't train our eyes. You can prolong the need for reading glasses. You can decrease the power that's needed for reading glasses by exercising the visual system and by developing better control over focus stamina and focus flexibility. And there are lots of exercises that can be done at home as almost like a daily ritual, kind of like meditation or going to the gym. I have a lot of my patients, here's the top 2, top 3, top 5 things I want you to do every day. And it can definitely slow down the anatomical changes that occur, and in many cases, dramatically.
Love it. Mic drop. Thank you so much. Thank you for coming on the show today and sharing so much. I know I and the listeners didn't know about their vision and how it's different from eyesight, right? So I know this will be helpful to many. Thank you so much. This was awesome.
Appreciate having me on here, and thank you so much for offering this to your listeners.